Hi everyone, this is Dr. Nick Ravon, endocrinology, metabolism, and thyroid interventionalist. The question I get asked by a lot of providers is that we have no idea what radiofrequency is. It doesn't work. It's experimental. Guess what? It is not experimental. Yes, it does work. It's an FDA-approved procedure. We have now been doing this procedure for 4 years, and I can tell you the results are astronomically good. No matter how much you try to dodge the bullet here versus there, guess what? The procedure works very effectively. It's kind of redundant for us to keep posting videos on every single patient we do, but sometimes patients ask us, and this is a patient that wants us to post a video, and here it goes. I hope you guys enjoy. All right, guys, this is Joan's nodule on the left-hand side. You can see it has a large nodule causing compression, not only of the trachea, but pushing the esophagus downward. The nodule goes from left to the right. It is a large nodule, which we then recommended to undergo final aspiration on the ultrasound guided. Here is the images of the final aspiration. Successful biopsy, you can see the needle within the thyroid tissue. We made 3 to 4 passes and the biopsy results were benign. Then we recommended radiofrequency ablation. This is the 1 year post radiofrequency ablation. You can see the nodule volume initially went from 0.75 milliliters all the way down to 0.04 milliliters. That is a 94% reduction. And a patient was told to go to surgery, who said no, radiofrequency is a better option. Here you can see further images of the nodule 1 year post radiofrequency ablation. You can see outstanding results. The structure of the thyroid looks really good. The thyroid lobe is preserved. The esophagus, trachea, all well within normal limits. Here you can see actually the video of the thyroid, and you can see the thyroid tissue is preserved, the nodule, scar tissue is noted. Therefore, the patient has done very well. Hi everyone, this is Dr. Sean Nickervon, thyroid interventionalist. This is lovely Joan. Joan, how are you?
I'm fine.
Joan is here for her 1 year post radiofrequency ablation, but her story is of some educational value to all patients and all providers. So I'm going to let Joan start the story. So Joan, when we first saw you, you had a large nodule on the left-hand side. It measured 1.1 by 1.14 by 1.25 centimeter with a volume of 0.75 milliliters. The nodule was sitting on the left-hand side, causing compression discomfort. So when I saw Joan, I said, Joan, we can take care of this through radiofrequency ablation, and I'll let you go with the rest of the story.
Well, so I scheduled the treatment, but right prior to that, I saw my OBGYN for the annual checkup and mentioned to her that I was going to have this procedure, and she was hesitant, not being familiar with it as a standard treatment, contacted an endocrinologist colleague who said, I'm not that familiar with the treatment, so I'm not sure that I can recommend it. And then another friend of mine who is an endocrinologist at Stanford, I contacted to see if he recommended the treatment, and his suggestion was a wait and see attitude. So I was going to cancel, and Dr. Nickervon highly suggested against that, so I went forward with the treatment.
So now we are 1 year post radiofrequency ablation today, and her nodule has gone from a volume of 0.75 milliliters to 0.04 milliliters. This is a 94% reduction. Joan does not have a scar, she does not take thyroid medicine, and our recommendation was right on. We started radiofrequency approximately 4 years ago, and this procedure was done just last year. And last year, that means 3 years ago, we were doing this procedure and people still did not know about it, which is kind of concerning, because why would you put someone through a major invasive procedure like thyroid surgery when you can radiofrequency, especially if they're compressive symptoms? So congratulations, you did very well. We like to make this educational for patients and also other providers to understand that there are other alternatives to thyroid surgery that can be very successful if done by the right interventionalist, because you want to have no complications and you want to get great results. And 94% reduction in 1 year is just the beginning of it. I anticipate it to continue to reduce in size with no complications. So congratulations.
Thank you.
You did very well. Thank you for entrusting us, and congratulations.